Today we're going to be taking a closer look at macrolide antibiotics, and I think this is going to be really interesting because we're going to be focusing on the potential dangers lurking beneath the surface when these commonly prescribed antibiotics interact with other medications, and this is something that I think every healthcare provider should be aware of.
Absolutely. You hit the nail on the head there. It's not just about knowing what drug to prescribe, but understanding the bigger picture. How does this medication fit into the patient's overall health profile? What other medications are they taking, and are there any red flags we need to be aware of? These are crucial questions we need to be asking ourselves with every prescription.
So let's start with the basics. What exactly are macrolides, and why are these interactions such a big deal?
So macrolides, they're a class of antibiotics that are super common for treating bacterial infections. They're effective for a wide range of conditions, from respiratory infections to skin infections. So you're going to see them prescribed pretty frequently. Two of the most common ones you'll come across are clarithromycin and erythromycin. Now, the problem with these particular macrolides is that they can interact with other drugs in a way that can cause some pretty serious side effects.
So I know we see a lot of patients on statins these days for cholesterol management. What's the connection between macrolides and statins, and why should we be concerned?
Okay, so that's a really important interaction to be aware of. Both clarithromycin and erythromycin can significantly increase the concentration of certain statins in the bloodstream. We're talking about a pretty substantial increase here. And the statins we need to be particularly cautious about are atorvastatin, lovastatin, and simvastatin. I always remember those three as ALS to help keep it straight.
ALS. Got it. So what happens when these specific statins are mixed with either clarithromycin or erythromycin? What are the risks?
The biggest risk here is rhabdomyolysis, and that's a serious condition. You're basically talking about the breakdown of muscle tissue, which then releases harmful substances into the bloodstream. And those substances, they can wreak havoc on the kidneys, potentially leading to kidney failure. So it's definitely not something to take lightly.
So if we have a patient on one of those ALS statins and they need an antibiotic, it sounds like clarithromycin and erythromycin are off the table.
Yeah, you got it. You want to avoid those combinations if at all possible. The risk is just too high. It's better to choose a different class of antibiotics altogether or consider a safer macrolide option, which we'll talk about in a bit.
Now, I know that macrolides can also interact with calcium channel blockers, which are commonly prescribed for high blood pressure. What's the story there?
Right, so this is another important interaction to keep in mind. When you combine erythromycin or clarithromycin with calcium channel blockers like amlodipine, you can actually amplify the effects of the calcium channel blocker. And this can lead to an increased risk of hypotension, which is basically low blood pressure. Now, you might think low blood pressure isn't a big deal, but it can actually be quite dangerous.
Especially for certain patient populations, right? Like older adults, for example.
Exactly. Older adults are particularly vulnerable to the effects of hypotension. They're more likely to experience dizziness, fainting, and even falls. And in severe cases, it can even lead to organ damage and require hospitalization. So it's definitely something to be cautious about.
So we've talked about two major interactions to watch out for macrolides with certain statins and macrolides with calcium channel blockers. Does this mean all macrolides are equally risky?
Thankfully, no. Not all macrolides carry the same risk profile. There's one in particular that stands out as a safer alternative, and that's azithromycin.
That's good to hear. So what makes azithromycin a better choice compared to clarithromycin and erythromycin when it comes to these interactions?
The key difference lies in how they interact with an enzyme in the liver called CYP3A4. Now, this enzyme plays a critical role in metabolizing a lot of different medications, including those statins we talked about, clarithromycin and erythromycin. They actually inhibit CYP3A4, which means they basically slow down the breakdown of those medications.
So they're kind of like clogging up the system.
That's a good way to think about it.
Yeah.
And because of this inhibition, you get a buildup of the statin in the bloodstream, which increases the risk of those nasty side effects we talked about, like rhabdomyolysis. Now, azithromycin, on the other hand, it doesn't inhibit CYP3A4 to the same extent, so it's less likely to cause those dangerous interactions.
So if we're looking at macrolides, azithromycin seems like the safest bet if we want to minimize these risks.
Exactly. It's generally considered the preferred choice, especially for patients who are already taking medications like statins or calcium channel blockers. And there's another bonus with azithromycin.
Oh, there's more. What else makes azithromycin stand out?
Well, it also has minimal impact on something called the QT interval. This is basically a measure of the heart's electrical recharging time. And some medications, including certain macrolides, can actually prolong the QT interval, which can lead to some dangerous heart rhythm abnormalities.
So azithromycin is a win-win then. It's less likely to cause drug interactions, and it's also safer for the heart. That's pretty reassuring.
Exactly. That's why it's often the top choice when a macrolide is needed.
This is really valuable information for healthcare providers. Knowing that there's a safer option like erythromycin within the macrolide family can really make a difference in patient care.
Absolutely. It's all about weighing the risks and benefits and making informed prescribing decisions to ensure the best possible outcomes for our patients.
So even though erythromycin is generally safer, it's still important to be vigilant about potential interactions, right?
You're absolutely right. It's not a free pass. We still need to be mindful of the patient's entire medication list before prescribing any macrolide. Are they taking any statins, any calcium channel blockers? These are critical questions to ask.
Absolutely. And I think patient education plays a big role here, too. We need to make sure our patients understand that all medications, even antibiotics, can have side effects and can interact with other drugs.
I couldn't agree more. We need to empower our patients to be active participants in their healthcare. Encourage them to tell us about all the medications they're taking, including over-the-counter drugs and supplements. It's all part of the bigger picture.
You know, it's amazing how many patients don't realize that something as seemingly harmless as an herbal supplement can actually interact with their prescription medications.
You're telling me it's so important to emphasize that everything they put into their body medication-wise can potentially have an impact.
Absolutely. And what about the signs and symptoms of those serious side effects we talked about earlier, like rhabdomyolysis? How can we empower our patients to recognize potential problems and seek help when needed?
We need to give them the tools to be their own advocates. Make sure they understand the red flags, to watch out for muscle pain, weakness, dark urine. These are all warning signs that should never be ignored.
So if they experience any of these symptoms while taking a macrolide, they need to contact their healthcare provider right away.
Exactly. No question about it. Early intervention is key.
So being proactive and empowering patients with knowledge is absolutely crucial. It's a partnership between healthcare providers and patients.
Absolutely. Open communication is at the heart of it all. We need to work together to ensure safe and effective medication use.
This has been incredibly insightful. We've really delved into the potential dangers of combining certain macrolides with other medications. We've explored the safer alternative of erythromycin, and we've discussed the importance of patient education and clear communication.
It's all about awareness education and informed decision-making. At the end of the day, our goal is to protect our patients and provide the highest quality care. It's been a pleasure sharing my insights, and I hope our listeners have found this deep dive to be helpful and informative.
I'm sure they have. And to our listeners, thank you so much for joining us on this journey into the world of macrolide antibiotics. We'll see you next time for another deep dive into the fascinating world of pharmacology.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.